Sinusitis is a common infection that we encounter in our clinical practice. It's an infection of the sinuses that can result from a common cold or sometimes from allergies. The two typical things that I'd like to talk about today are the use of CT scans and X-rays and antibiotics that are sometimes used to treat sinusitis. Yes, sinusitis makes us feel bad. The symptoms sometimes can be intolerable. They take you away from work and your family life, and we want a quick fix. However, neither of these two interventions are really shown to be better at getting you back to work or getting you feeling better sooner. There are very few situations where a CT might be indicated. If you have recurrent episodes of sinusitis and treatment, including medications, is really not working for you, your doctor might consider surgery. And in that case, a CT would be appropriate. Antibiotics, they're sometimes prescribed for the treatment of sinusitis, but there are only very few situations in which they're really appropriate. In other cases, the wiser choice is not to get antibiotics. And here are the reasons. Antibiotics only work against bacteria. Sinusitis is typically caused by viruses, so antibiotics just don't work. Secondly, antibiotics are powerful medications. Sometimes they're expensive, and they can also cause a lot of side effects, including a rash, abdominal pain, and other complications. Antibiotics are seldom indicated for the treatment of sinusitis. Some indications might be a high fever over 101 degrees, symptoms that don't get better over a week. In those cases, it might be appropriate for you to discuss this with your physician. But in the majority of cases, just talking to your doctor and to your pharmacist so that you can get medications over the counter or prescribed that can make you feel better is the more appropriate way to go with sinusitis. So keeping this evidence in mind, several of the associations have made recommendations against the use of antibiotics for the treatment of sinusitis. The American Academy of Family Practice and the American Academy of Pediatrics have both made these recommendations. So next time you have this, consider talking to your doctor and making a wiser choice rather than using powerful medications and wasting resources that will not make you feel better any quicker.